How to tackle recurring urinary tract infections, UTIs. Urinary tract infections, or UTIs, are not just a temporary inconvenience. They're a common issue that can impact your daily life, causing discomfort and frustration. For those experiencing recurring infections, the struggle can feel never-ending. But here's the good news. With the right knowledge and habits, you can prevent many of these infections and take control of your health. In this video, we'll explore practical ways to tackle recurring UTIs, from everyday preventive measures to understanding when medical intervention is necessary. A UTI occurs when bacteria enter the urinary system and cause an infection, often affecting the bladder, called cystitis, but sometimes spreading further to the kidneys. Common symptoms include a burning sensation during urination, frequent urges to urinate, cloudy or strong-smelling urine, and even pelvic pain. Why do UTIs happen? Most UTIs are caused by bacteria, like E. coli, that are naturally found in the gut, but accidentally invade the urinary tract. Women are more prone to UTIs because of their shorter urethra, which offers bacteria a quicker path to the bladder. Other factors such as sexual activity, certain hygiene habits, and even how much water you drink can increase your risk. Recurring UTIs can be uncomfortable, inconvenient, and even lead to more serious complications. The best way to avoid this cycle is prevention. Let's explore some simple but effective steps you can take every day. One of the simplest ways to lower your risk of UTIs is staying hydrated. Drinking enough water helps flush out the bacteria that may have entered your urinary tract before they can cause an infection. Aim for at least 6-8 glasses of water a day, and always listen to your body's thirst signals. If you notice your urine is dark yellow, that's usually a sign you need to drink more water. Good hygiene can go a long way in preventing UTIs. Always wipe from front to back after using the bathroom. This simple habit reduces the chance of transferring bacteria from the rectum to the urethra. Avoid using harsh soaps, feminine sprays, or douches, which can irritate the sensitive urethral and vaginal area and disrupt the natural balance of bacteria. Prevention doesn't stop at hydration and hygiene. Here are a few targeted steps to further lower your risk. Sexual activity is one of the common ways bacteria might travel to the urinary tract. Urinating immediately after sex helps flush out any bacteria introduced during intercourse, reducing the likelihood of an infection. Make it a habit, even if you don't feel like you need to go. What you wear can also affect your urinary health. Tight-fitting clothing, like skinny jeans, can trap moisture and encourage bacteria growth. Opt for loose-fitting pants and choose cotton underwear, which allows your skin to breathe and keeps bacteria and yeast at bay. In addition to everyday habits, many people turn to natural solutions such as cranberries and probiotics to help prevent recurring UTIs. Let's examine how these could help and whether they're right for you. Cranberries have long been associated with UTI prevention. They contain compounds called proanthocyanidins, which may prevent bacteria from sticking to the wall of the urinary tract. Cranberry juice and supplements have shown promise in some studies, particularly for people prone to recurrent infections. However, their effectiveness varies from person to person, and they aren't a guaranteed solution. If you choose to try cranberry products, look for those low in added sugar and stay consistent. Probiotics are another promising option. These good bacteria support a healthy balance in your gut and urinary tract, helping your body fight off infections. Probiotics like lactobacillus are particularly beneficial for urinary health. You can incorporate them into your diet through foods like yogurt, kefir, and fermented vegetables, or take a daily supplement. So, cranberries or probiotics, which is better? The reality is both can play a role in prevention, but should complement, not replace, good hydration and hygiene habits. Even with great prevention efforts, UTIs can still happen. Knowing when to seek medical help is essential. Antibiotics are the go-to treatment for active UTIs and can quickly eliminate the infection. Your doctor may also recommend a preventive course if you have frequent infections. However, frequent antibiotic use carries risks, such as side effects and antibiotic resistance, a condition where bacteria become harder to treat over time. That's why antibiotics should be used responsibly, under your doctor's guidance. Not all UTIs can be managed at home. If you notice symptoms like fever, flank pain, or blood in your urine, this could signal the infection has spread to your kidneys. In such cases, seeking immediate medical attention is critical. For anyone prone to recurring UTIs, small, long-term lifestyle changes can make a big difference. Let's discuss some key adjustments. Make it a habit to empty your bladder when you feel the urge. Holding your urine for long periods allows bacteria more time to grow, increasing your risk of infection. Practicing regular bladder emptying is a simple way to stay healthy. Your diet can directly and indirectly affect your urinary health. Certain foods and drinks like caffeine, alcohol, and spicy foods can irritate the bladder and should be consumed in moderation. Focus on nutrient-rich foods like fresh fruits, leafy greens, and whole grains, which support a healthy immune system and may reduce infection risk. Chronic stress can weaken your immune system, leaving you more vulnerable to infections. Practices like yoga, meditation, and regular exercise can alleviate stress and strengthen your immune response over time. There's a lot of conflicting information about UTI prevention. Let's clear up a few common myths. Myth: UTIs are only caused by poor hygiene. Fact: poor hygiene can contribute, but other factors such as anatomy and sexual activity also play a role. Myth: drinking cranberry juice will cure a UTI. Fact: cranberries may help with prevention, but they won't cure an active infection. Antibiotics are needed in such cases. Myth: UTIs are always linked to sexual activity. Fact: while sexual activity is a common risk factor, UTIs can occur for many other reasons, including dehydration and hormonal changes. Science is continually advancing our understanding of UTIs. Recent research has explored cranberries. Some studies confirm their preventive role, though not universally effective. Probiotics. Emerging findings suggest these could help balance the urinary and digestive microbiomes and prevent infections. New treatments. Scientists are working on alternative therapies for recurrent UTIs, including vaccines and non-antibiotic treatments. Staying informed about these developments can empower you to make better health decisions and discuss options with your healthcare provider. Recurring UTIs don't have to feel like an inevitable part of life. By staying hydrated, practicing good hygiene, exploring natural supplements like cranberries and probiotics, and making small lifestyle changes, you can dramatically reduce your risk. Just as importantly, know the signs when medical help is needed and trust your healthcare provider to guide you. Remember, there's no one-size-fits-all solution. Combine these preventive strategies, stay consistent, and make your urinary health a priority. You have the power to tackle recurring UTIs and live a healthier, more comfortable life. Stay proactive and take charge.